Myself is Alakshi, Assistant Professor from SNS College of Physiotherapy, and today I would like to call upon Dikshita, final year student, to present a case study. Go ahead.
This case study was taken during my clinical postings in Sri Shiva Hospital. 22-year-old female came with chief complaints of multiple region pain and right hand swelling. It was occasionally. And subjective examination was taken. She had severe vitamin D deficiency before 1 year. Subjective examination was done. The patient had a severe vitamin D deficiency before 1 year, and she came to the hospital with present history of right knee pain and left fingers swelling. Personal history: she was not a smoker and she was a non-alcoholic. Personal history, family history. By asking the family history, we came to know that the patient's grandmother has autoimmune disease. Medication history: the patient used to take painkillers occasionally, like diclofenac only during flare-ups. There was no history of any surgery. Pain history was taken. Pain had a gradual onset and it was very acute. Patient rated the pain on a scale of 8 in VAS scale. The pain aggravated during movements and the pain subsides while resting. On observation, the patient had a mesomorphic body build. Her posture was normal. She came to the hospital with antalgic gait. She was supporting the left wrist with the right hand. Next, on palpation, there was warmth around the right fingers and left fingers. Tenderness of grade of 3, and crepitus was felt when the knee was moved passively. Next, on examination, range of motion was tested in both upper limb and lower limb. Both the limbs were normal. Muscle tone was assessed and it was also normal. Next, sensory examination and motor examination for both upper limb and lower limb was done. Both the examinations was also normal. The patient had a normal limb length. Next, the patient was asked to take several blood tests like C-reactive protein, erythrocyte segmentation rate, rheumatoid factor, next complete blood count, and anti-CCP, anti-nuclear antibodies. Provisional diagnosis: from the blood test impression, it was noted that the patient had a strong RA positive. And differential diagnosis: systemic lupus erythematosus, septic arthritis, and pyogenic arthritis. Management was started. Medical management: physician advised to take disease modifying agents like immunosuppressants, muscle relaxants. Physiotherapy management: back therapy was given to both the knees. Ultrasound therapy to the left swollen fingers. Ultrasound therapy was given with 3 megahertz for 7 minutes in continuous mode. Stretching to both upper limb and lower limb was given. The stretch hold was for 10 seconds and repetition was for 7 times. It's a mild strengthening exercise for quadriceps and hamstrings was started with the therapy. Next, the patient was sent home with the follow-up after 6 days. Thank you.
Since I'm a cardiorespiratory physiotherapist, I would also like to add a note on it because when we are seeing rheumatoid arthritis patient, we also insist on ACBT technique. So as we all know, ACBT is nothing but active cycle breathing technique, in which we will be encouraging the patients on a repeated cycle method of breathing, puffing and coughing technique. So it is also incorporated for rheumatoid arthritis patients. And also that is a very major concern that has to be taken in mind is we should not encourage or incorporate heavy stretching or heavy strengthening kind of exercise to rheumatoid arthritis patient. Do you know what the reason behind that? So since it is rheumatoid arthritis, the bones might be fused. So the distal bone and proximal bone, whatever the region it may be, it might be fused. So whenever we are giving a stretching or strengthening in a very vigorous customers. So as a physiotherapist, you should always keep in mind that strengthening and stretching should be given in a very mild manner. Okay, is there any doubt in it? Thank you.